Good evening to those who are just joining with us. Just a reminder that you can comments into the comment bar and address it in 30 seconds. Thank you for joining us.
Hello, everybody. Good evening. Thank you for joining with us tonight. The 2 weeks seem to have gone by so quickly, and we actually have quite a bit of information to share with you tonight. As you know, our goal here at the Bob Rumble Home is to keep our residents and our staff safe. And we've been working very hard on finding ways that we can continue to do that, given the fact that we've been given specific directives from the Ministry of Health that we feel may not be the most timely of directives. However, I just wanted to share with you the fact that we did put off the absences for 2 weeks. Excuse me. For 2 weeks, but it is a directive, so we have to follow the ministry guidelines, not the ministry guidelines, but the ministry directives. So as of tomorrow, we will begin allowing absences from the home with our residents. So I'm going to talk to you about the policy. I know that I sent both policies to you. I'm just going to briefly cover the resuming visits one. As you can see, it's now into its 4th revision. So we'll just talk a little bit about what changed, and then we'll look at the new policy that we have now as of tomorrow, short stay and temporary resident absences. So just to give you an update on staffing, I mentioned 2 weeks ago that we had 11 potential new employees coming on board. Out of those 11, we have 4 left. We have 2 more people that we are hoping will start soon, and we have 1 more potential person that we'll be hiring. So as you can see, we are still not up to full staffing. We're still actively recruiting. If you know of anybody in the healthcare field, we're sort of everybody, all of the homes are going through the same. And I'm sure you've heard in the media about Simcoe County, and I also think Waypoint, they're having job fairs where they're looking for RNs, RPNs, PSWs, and the new classification similar to our resident assistant. The problem with that is they pay much more than we do. So it's very hard for us to be competitive with them. So like I said, if you can help out in any way in terms of knowing anyone, please let us know. I'm going to talk to you a little bit about, before I start with the policy, about the second wave. So we received correspondence from our association that we belong to, which is called Advantage, and their job is to advocate for us at the ministry level to help us interpret a lot of the directives and regulations that come down from the ministry. And so what they told us is that we're entering a second wave, or they call it a wavelet, which is not a word I've ever heard before, in parts of Ontario. So this is as of September 14th. According to the media, there were 11 homes in the Ottawa area that were in outbreak, 31 homes across the province in outbreak, and the extended care in Ottawa has a significant outbreak with 27 residents and 3 staff tested positive. So I don't know what to say to you when we begin to talk about you being able to take your loved one out, because what we're seeing in the community is is just a growth and a spread of this pandemic. I also want to share with you that the Assistant Deputy Minister of Long-Term Care Operations sent out letters where COVID infection rates are rising to warn operators to get ready. They also sent out letters to all the operators, including ourselves, and the tone of the letter places most of the responsibility on the homes to fight the outbreaks as opposed to the province. So I just wanted to read to you, sorry, I have it here, read to you what was said. I thought it was more organized. Here we go. So in the Assistant Deputy Minister by the name of Richard Steele, he has written long-term care homes responsibilities around ensuring a safe and secure environment. I would like to take this opportunity to remind you, the operators, of your responsibilities pertaining to ensuring a safe and secure environment for your residents, as is dictated in the Long-Term Care Homes Act, specifically to effectively prevent and manage outbreaks. Every licensee must ensure that, then there's a list of things we have to do, which we do. Ensuring the provision of required staffing is ultimately the responsibility of the licensee, and I ask that you continue to do what you can to address the most pressing need. The ministry is aware that all of the homes are struggling right now for staffing. Approaches to scheduling, particularly in relation to weekends and long weekends, require particular attention. Homes that are not, that's not important. Please note that going forward, the supply of hospital resources is becoming more scarce as hospitals address their own human resource challenges and ramp up services. As such, there may not be available to assist to this extent that you may require. Over the past days, we have seen a surge in community infection rates and outbreaks in long-term care homes. Please monitor the infection rates in your community. We will also communicate with those homes that are in communities with increasing rates to take necessary enhanced precautions and actions such as screening, regular testing, and other measures in accordance with the government issues, directives, communications, and guidance. So on the one hand, we're being told this. On the other hand, we've been given a directive which says that our residents are allowed to go out on a short stay, which means they could go out for the day. So we've developed a policy, and I sent it to you, so I don't know if you want to follow along or if you've already read it. Short stay absences are residents may leave the home's property for a short stay absence, which basically means they can go out for the day. And they can go out for healthcare or social, they can go out for any reason. The resident or the substitute decision maker must provide us with written consent to the absence. As with any absence, if a resident requires assistance leaving the building, the person taking the resident out must come into the home, complete the paperwork with the resident, pick up medications as required, and assist the resident with their departure and return to the home. So the person who's coming to take the resident out performs these tasks in the home. So they would need to be an essential visitor, support worker, or caregiver, or an indoor general visitor. As such, this visitor must meet the applicable screening criteria. So what we're saying is we don't have the manpower or the staff to be taking residents to the front, getting them all ready for you to just come and pick up and drive away with. You're going to have to come into the building. You're going to have to go through the screening. You're going to have to attest to having a COVID negative test within the last 14 days. You will then be allowed to go into the lobby area where the nurse will meet you with the resident to go over whatever necessary information there is or to give the medications. When you return, you will need to You need to let us know what time you're back. The resident will be screened at the front desk, but will then also be screened when they are returned to their room by the nurse. And the person returning the resident will need to be screened also, just as you would if you were a visitor or a caregiver or a support worker. This, however, does not apply if the resident is able to physically and mentally leave the home and return on their own. So if they're able to decide they want to go out and they're capable of going out and making those decisions and they're physically well, they're allowed to do that. However, if they need assistance, they're going to need your assistance. So just following down on the policy, the resident will require active screening when leaving and upon return. Prior to leaving the home, the nurse will actively screen the resident, including a temperature check. If residents have symptoms, then obviously they won't be going out. The resident is able to leave for a short stay absence is not required to have a COVID test or self-isolate when they return home. Residents will be provided with a medical mask to be worn at all times when outside, if tolerated, and reminded about the importance of public health measures, including physical distance. Note, if the resident is not able to tolerate a mask at all times when outside the home and cannot practice physical distance from other persons when outside the home, the resident is at risk of a COVID-19 exposure, and a short stay visit will be discouraged. An exception would be if the person within the 6-foot distance is a designated caregiver, support worker, or indoor visitor. Outpatient medical visits are considered a short stay absence, and they do not require COVID testing or self-isolation. Short stay absences do not include an overnight stay, unless they go to emerge and they stay 2 nights or more, or they are admitted. Then we would go into our regular medical leave. But if they end up going to emerge and they're there 1 night and they come back, that's not considered, they do not have to be COVID swabbed and they do not have to be isolated. So if a resident is, is admitted to the hospital, we have, we have readmission screening tools in place. Okay, so that's how it's going to work if you want to take your family member out for a day visit. There would be other questions we would be asking you. Where are you going? Who are they going to be in contact with? And again, this is all done because we're looking at the risk. We're trying to mitigate the risk. We're trying to keep everybody safe. And I know that all of you from the survey that we did 2 weeks ago are in agreement with what we're doing. And I just wanted to say thank you. You've been so supportive and so encouraging. That has made the job a little bit easier because we know that our families agree with us and want to keep their loved ones safe. So we do appreciate that, and we continue to work well together. We're going to be much more successful. So I do want to talk about temporary absences. This is where a resident goes to someone's home overnight. So there's a whole risk assessment that the home would do. So what you would do is call and say, I would like to take mom or dad out overnight. It would be to Amy. She will have a list of questions that she will ask you so that we can then do a risk assessment on the resident in regards to that visit. So temporary absences are a case by case, they're looked at. And what we're looking at is what's the local disease transmission and activity in the area? Are there upward trends? Are they acceptable? Is the home in an outbreak? What's the risk or the associated risk with the planned activities that will be undertaken by the resident while out of the home? We look at risk, likelihood of getting COVID, and how it would affect them in terms of severity. What is the resident's physical status and potential negative effect on the resident if they were affected? Is the substitute decision maker consenting to the risk and for self-isolation after the absence, because they will have to be isolated for 14 days? What is the length of the time the resident is expected to be out? Is this person, and that would be the person that's taking the resident out, are they prepared to be responsible for any negative fallout impact from staff or from residents if the residents become infected due to the resident's transmission of the virus? That is something that you need to take into consideration before taking anyone out. You have to consider everybody in the home, the other 63 residents and the 80 staff that we have, and everybody else. What is the resident's ability to comply with local and provincial policies and bylaws? So, for example, my dad is 89 and has dementia, and he's not in a home yet, living with my sister. My brother took him to Tim Hortons. He wouldn't wear a mask. He would sit where he wanted. He was non-compliant with what was needed to be done, and the decision was made, we can't take him out anymore. So those are the kinds of things you need to think about when you're taking the resident out. Do you support the isolation of your loved one for 2 weeks after they've been away? So those are some of the things that we look for when we do a risk assessment. So we would take all of those things into consideration, and then a decision would be made by the nursing department as to whether or not we would agree to having the resident go out. I have to tell you, they wouldn't be here if they weren't already compromised, if they weren't already frail. So I'm trying to imagine us putting pen to paper that says, yes, go ahead, take your family member out, they're going to be safe. So it's a discussion that we're going to have when the time comes. The rest of the policy really covers our day-to-day business that we already do. So when a resident goes to hospital and they're readmitted, it covers those kinds of things. It covers medical leaves or psychiatric leaves, all of those kinds of things we do now. So I'm not going to go over all of that with you because I don't think it's necessary. I think what you're most interested in is short stay absence and a temporary absence. There's also a reference document for symptoms on the back of this policy. So please read it, and you need to read it monthly. So I'm just going to touch on the resuming visits during a pandemic. So I was listening to a lawyer talking about doing visits, doing absences. And something she said really struck me. As a substitute decision maker for a resident, the person is appointed to make decisions for an incapable person. So they're expected to keep the same principles of the legislation. So you have a legislative responsibility. And I don't think people think about that when they think of power of attorney or substitute decision maker, but you have a legal responsibility to not put the resident at risk. You can put yourself at risk. You can do whatever you want, but you need to think about what is the risk to my loved one, because they've trusted me to make decisions on their behalf. Are you making a good decision? Those are things that you need to think about. And I was struck by that because I personally hadn't really thought that strongly about it, because I've just become a substitute decision maker for my parents. And so it's something that I really need to consider when I'm making decisions for my loved ones. So this particular policy is now in its 4th revision. It's important that you read through it and that you read it monthly. And you have to attest you're reading it monthly. That's part of the directive. So on page 2, there have been significant changes to this policy. Regardless of what type of visitor it is, important to read the policy prior to your visit. Caregivers and general visitors must attest to having read the policy prior to their first visit and have reread the policy monthly thereafter. That is your responsibility. So they've changed some of the wording in terms of the individuals that are coming in. Amy's still responsible for all of the scheduling. We just want to remind you that we do our very best to meet everybody's need, but it's getting very busy. We now have, I'm just going to show you this. This is a flow chart of, and this is just around visitation. So this is nothing to do with the care of the residents. This is just us being able to manage how visitors come into the home, how they're defined, what they're allowed to do, what we can do. So it's a lot of work. So there may be times where Amy's got a completely full day of people coming and going, and now we're adding absences and temporary leaves. So there may be times where we have to say that we've kind of hit the maximum for the day. We're also getting into cooler weather. So we've been talking about the outdoor visitations. We had thought we could change the outdoor visitations to the afternoon because it's warmer, but we don't have the staff or the funds. So we are not able to do that. So visitations continue to be in the mornings. And we're thinking that 18 degrees or under, the residents don't want to go out and sit there. Even if we bundle them up, it's too cold. So we're probably looking at migrating more to indoor visits. If we're able to do afternoon visits, we will. But at this point in time, we don't have the manpower and we don't have the funds. So the ministry has made some changes in regards to essential visitors. So there's definitions under types of visitors, and they're a little bit different. So essential visitors, they've now divided those into 3 categories: support worker, caregiver, and other essential visitor. So a support worker is somebody like a maintenance worker or a person delivering food. They're not staff. And if a visitor comes in, so I'll use this example. If a visitor comes in, let's say they're deaf-blind, and they're coming in to visit someone in the home, and they need a support worker to help communicate. The support worker is allowed in as an essential visitor and does not have to be, what would be the word, approved. They would just come in to support the visitor who's visiting the resident. Then there's a caregiver, which is family members. You are allowed to pick up to 2 caregivers. A maximum of 2 essential caregivers may be designated, and they can change from time to time if something happens health-wise to the caregiver, or if the resident's care needs change. We are told that there should be only 1 caregiver at a time. We will make exceptions if it's necessary. So you just need to talk to us about that. We're pretty flexible. So caregiving visitor hours are 6 a.m. to 6 p.m. 6 days a week. And we've now extended Wednesdays to 8 p.m. in case there are people who want to visit after work. This was requested 2 weeks ago. To date, there has been nobody that's taken advantage of this, but we'll continue to offer it for now. And it's important to note that caregivers must receive active screening coming into the home anytime between 6 and 4:30 by the screener. Caregivers leaving between 4:30 and 6 p.m. every day, but Wednesday, must be screened by an identified staff. So we may not have a screener. You would then ask the nurse to screen you out. On a Wednesday, a screener, if necessary, will be available until 8 p.m. There's something called other essential visitor. And so a person who meets the definition of an essential visitor, but is not a support worker, a caregiver, or a staff person, is a person visiting a very ill or palliative resident, a government inspector, or emergency responders. So a palliative visitor is an essential visitor who is visiting a very ill or palliative resident. They do need to pass the active screening and attest to not experiencing any typical or atypical symptoms. Only one palliative visitor must visit the ill or palliative resident at a time. We have permitted two, and we would do if it was necessary. You can have two palliative visitors at one time. So if you have a family of four, take turns and you can come in, which is a change from before when it was only one assigned person. You have to verbally attest to having a COVID-19 negative swab. A government inspector is an essential visitor who, under the authority of the long-term care's governing legislation, a government is an essential visitor who, under the authority of the long-term care governing legislation, comes into BRHD to inspect requirements under the Act. So it could be a fire marshal, could be Ministry of Labor, a public health inspector, the fire marshal testing the fire alarm when it's not an emergency situation, and the government inspector are exempt from this policy. However, the government inspector must pass the active screening. They do not need to have the COVID-19 swab. The emergency responder is an essential visitor who is responding to an emergency, and so they are exempt from screening and from a negative COVID test. Now, if they're coming in to pick somebody up and it's not an emergency, we will screen them. And then we have our general visitor, which is not an essential visitor. It's just somebody who's coming in to visit in our lobby, and those rules haven't changed. The indoor and outdoor general visitors, all the rules remain the same. Just going through this quickly. There are at the back how to put on PPE and how to take PPE off and how to hand wash, etc., as you had last time. Sorry, what am I looking for? So when you come into the home, as I mentioned, we have now 8 categories. We have 8 screening tools, all depending on which category you fall into. So for the staff and the screeners, they have to be retrained because there's been these changes. So please bear with us when you come in if we're not sure which binder you're supposed to go into. We'll get it figured out, and as soon as we get it figured out, they'll change it on us again, I'm sure. A couple of things around essential visitors. What's really important is that caregivers be reminded about the policies, read the policies. We don't want you to be, say, for example, at meal times, don't put the dishes away, don't wander around the dining room, stay put, stay with the resident that you're with. You can go from their room to where they're sitting, but you can't wander around the dining room. You have to keep your masks on. A lot of times we have to remind people to move their masks up. You can bring a drink in or food for the residents. but you have to keep your mask on, so you cannot bring in a drink or food for yourself at this time. Sorry, I just need to find this. Non-compliance is what I was looking for. This has not been an issue for us, and I don't see it being an issue for us going forward. But there were some new things in regards to non-compliance. So we will be monitoring any kind of non-compliance. If it got to the point where the person was not adhering and being difficult, then we have the ability to temporarily prohibit a visit. That's not something I would ever want to do. So we just all need to be able to work together. That's important. And also, talking about an indoor visitor hugging their loved one. So it's allowed, but we're asking you not to do it face to face, to do a side hug. And then, of course, BRHD, we have the hugging booths outside. And I think you already know the rules. Everybody's been great coming in and doing what was necessary. So I see there's a number of comments. Well, I can't read them. Amy's going to help me. So hopefully we can. Okay.
We've got a comment that says that directives, which make no sense to me. I will take my directives from you. You know I have my mom's best interest. Thank you for that.
So I would just like to say that our comment to you is, we strongly recommend that you do not take your loved one out. And that's as strongly recommend is all we can do.
Some other comments of support. Notice short-term absences. Better standards. Saying, no, where I know she is safe. I still think you understand the mask and not God bless.
I know it's difficult, and given what you're having to sacrifice, and the fact that you're doing it so willingly just shows the amount of love and care that you have for your family one, and we applaud you for that. And we are going to do our very, very best to take care of your loved one. And having said that, and having talked about the second wave, or if this home was to go into outbreak, I want to be totally honest with you. We would be in serious trouble. We're struggling to find the staffing now. If we went into outbreak, I would like to ask you if you would consider helping us, because we're going to need family support. And so I have to find it in all these papers. I have this form that I'm taking from our pandemic plan that we have. It's a Family, Friends, and Volunteers Emergency Response Assistance sign-up sheet, which I plan to email to each of you. And it's just basically saying that if we were to go into a pandemic outbreak, would you be willing to come in and volunteer for us? And I'm not suggesting that you come in and work with the people who have COVID. We have, I think, a very good plan in terms of cohorting people. If we have an outbreak, we're able to, which we do now, cohort 32 residents and 32 residents. We're able to do that 16 and 16. So if we ended up saying Care Center 1, A wing, we had one resident with COVID, they would be isolated. If we got to 2 residents, the wing would become isolated. All residents would have to stay in their rooms. And at that point, and the residents in the D2 wing, they would not be isolated because we're able to isolate the people in D1. Same with D3 and D4. So hopefully that will allow that will not mean that the residents are not going to be stuck in their, all of them, they're going to be stuck in their room. But we will need assistance, not suggesting you work with those who have COVID, but to work with those that don't, and helping us maybe with meals or putting away laundry, screening, assisting with reception, friendly visiting with some of the residents, light housekeeping duties. It's so hard to know who's going to get COVID, who's going to get sick, who's going to come to work, who's not. I have been told by staff that if we have an outbreak, they're not coming to work. So I already know that's not the ones that are sick. Those are just people who are not going to come in. So we're just sort of planning, hoping, praying that we never have an outbreak, but we want to be prepared. We don't want to be like those homes that have been in the news. We want to be prepared. We want to be able to take care of our residents. We don't want them suffering, and I know you don't either. So consider it. It's just a simple sign-up sheet that's got, I'll have your mobile number, your home number, and your email, and then we'll contact you. It does ask you when you're available, specific days, evenings, whatever, and if it need be, we could, you know, we would, that would be another group that we would call upon to help us. So I have been talking to the board about this as well in terms of what would we do if we went into outbreak? You know, are there other alternatives for us in looking for people? We're thinking about the churches, reaching out to some of the churches, reaching out to our sister organizations. So we are certainly going to be prepared if it happens. And we just pray that it doesn't. So.
The comment was on the comments, so if you could just remind people that can read the comments, and we appreciate those positive comments.
So I understand that you can't hear Derek, and Derek is just reading the comments to me because I can't see them. And Derek has also said that he really appreciates the comments that are coming through from the families. So thank you. Somebody's already offered to volunteer. Thank you so much. We'll be putting you on our list that we hope we never have to use. So that's about, I think that's about everything. I hope I covered. Yes, I will certainly leave. Oh, sorry. So the question was, if they don't have access to internet, can I leave these this family, friends, and volunteer form at the front desk? I will leave a whole bunch there so that you can pick them up and take them home and fill them out. Yes, thank you. So I'm not sure if anybody has any specific questions. You can always call me or email me. Derek Rumble, say something. Oh no, it's just right.
Hi, it's Derek here. I'm trying to remain behind the scenes because who wants this? We do appreciate all your comments and your support of what we're doing here. It's really important because our best working partner is the families who have loved ones with us. What you can count on from us is in this time when our government speaks in curious language. Sometimes they're speaking against themselves. You will always get a straight answer from us. And if we're not clear, please reach out to Shirley and the staff, and they will make sure that you get the right answer. Above all things, just be very, very confident that we are driven by one very sole purpose, is to protect your loved one, because like I said, for a very, very long time, I appreciate you lending me your loved one, because they become our loved ones too. So if you have any more comments.
I want to respond to a comment that I see up there. So someone has said, perhaps it is time to review the salary structure of PSWs. So
I'll leave that one for you.
thank you. So we're a home of 64, a nonprofit home of 64 beds, which is really small. So we, it's economy of scale. We don't have the funds to increase the salaries. There has been a push in the media and with some of the associations and with some of the unions to standardize PSW funding across the board. So PSWs in a hospital or in a municipal home or in a not-for-profit home or in a private for-profit home should all be making the same, and they're not. So the municipal homes are able to offer more money because, for example, this week, the municipal homes of Simcoe County were going to Simcoe County Council to ask for the funds to increase their salaries. We don't have anybody to go to except the fundraising that we do. And the money that we get from the ministry is standard across the board. So hospitals, they pay way more than any of the homes do. So it's very, we pay them as much as we're capable at this point in time. So I appreciate the concern, but it should be across the board, PSWs making the same. The wage disparity is incredible, from $16 to $23, and they're all doing the same amount of work. I see someone said, many thanks to the staff who continue to work a wonderful job at keeping our loved ones safe and healthy. I will pass that along to the staff and let them know. I think the staff do know, because you guys have done so much for us over the past few months that they do feel appreciated. And that makes a big difference with staff morale. Yes. I don't know if there's any questions, you know, and if you do, and you're calling Amy, she has all the answers. Actually, we're still all trying to figure it out. So I think we're going to do some role playing tomorrow, coming in as different types of people and seeing which book we put them in, and do we take their temperature? Do we ask them this question or that question? So hopefully by the time you come in, we'll have the staff properly trained. Oh, I just see something I have here. I might as well share it while we're waiting. So at the college, we get a lot of PSW placements throughout the year, which is great because they actually go out and work on the floor and are partnered with the PSWs. So they have decided to restrict PSW placements, which just again means that, you know, our resources are less than they were. So I feel like there's no way to win this, but we'll keep trying. So good. Oh, so it says that on a personal note, during my last visit to BRHD, it was incredible. There was incredible help was all around me. Okay, so I'm going to sign off and just say, call if you need to. Stay safe. Think about what we've talked about today in terms of your responsibility as a substitute decision maker. Think about the fact that your decision doesn't just affect you and your loved one, it affects a lot of people. So we really have to think long and hard if you feel like, I want to take mom out just for a drive. So having said that, the bus, which I promised you the residents were going out in, has been stuck at the mechanics, and he keeps finding more things. Now, I was told Friday it's ready, Monday it's ready. I said today, where's the bus? I'm going to be talking to the families. So I don't know where the bus is because nobody told me. But I do know that on Monday, Jessica will be taking residents all day, residents from Care Center 1. She'll be taking them out to Dairy Queen and for a drive. And then on Thursday, she'll be taking residents, anybody who wants to go from Care Center 2, out for a drive, out to Dairy Queen and around. So that for sure will happen because I know that the bus will be back here this week, or I'm going to go down and see the guy myself. So just to let you know that. Okay, so God bless, stay safe, talk to you soon.